Hi guys, good morning, good afternoon, good evening, wherever you are in the world. Thank you for joining me on this video. I'm coming to you from Arizona. Not so sunny today, a little bit miserable, a little bit bleak, a little bit wet, but most of the time we have sun and it's warm and wonderful. So I'm still in an upbeat, happy mood, and hopefully you are too. Today I want to talk about trauma. And when I say trauma, I mean psychological trauma, which is caused by past behavioural issues, past experiences where people may have been in a situation where they've been abused, where they've been beaten, where they've been shot, where they've been stabbed, where they've had negative emotions, developmental trauma, i.e. childhood trauma that was never resolved. So it's really all about the psychological trauma that has not been resolved. Now, one of the reasons why I wanted to talk about this today is because a lot of my patients do experience trauma throughout their journey and throughout their experience of living with a neurocognitive disorder. Recent research has shown that a negative experience is more clear in our memory than a positive experience. So let me just say that again. A negative experience has more clarity in our mind than a positive experience. Why is that, you might ask? You might think, well, that's a bit weird, isn't it? A bit strange, a bit odd. So for that, we need to think about the brain anatomy. We need to think about how it works. And when we're dealing with trauma, we're kind of dealing with two particular types of brain function, brain area. One of them is the amygdala. And when we're born, the amygdala is pretty much already formed. It's like a tiny pea structure on both the left and the right side of the brain. And they connect to the cerebral cortex, which is the thinking part of the brain. Okay, but it takes a little bit of time for that to happen during brain development and during adolescence and stuff like that. So it takes a bit of time. The amygdala is it's the seat of your emotions, and it's responsible for your fight or flight. Okay, so if you get into a situation where you fear yourself, you have to make this decision about, do I fight back or do I run away? And there's a millionth of a second to make that decision. And very often, once our amygdala is healthy and working and functioning with the thinking part of the brain, you will be in a situation where you might have to think about fight or flight. And if there is a door behind you, you're going to go through it. More often than not, you will run away. Only in situations where you feel cornered and threatened will you then fight back. But the amygdala, as a child, is in charge. The amygdala is everything. It's selfish. It's akin to Freud's id. It just is. It's primitive. It's everything. It's I want, I will have. So when you see a toddler in the supermarket throwing a tantrum because mum said, no, you can't have that, that's the amygdala response. So when you see a parent reprimand the toddler, the child, it's pointless, absolutely fruitless, because the amygdala doesn't care. I don't care what you say, because it's in charge, it's in control. When we have trauma, psychological trauma, the amygdala plays a huge role in it. So when people are experiencing flashbacks, which is part of the traumatic experience, when I think about post-traumatic stress disorder, PTSD, people have flashbacks, people have nightmares, people have difficulty separating the present from the past. So the two clash, reality is out the window, the past, the present, what is it? Is it in the past, is it in the present, or where is it? Now, if anybody's seen a show called Peaky Blinders, you'll be familiar with one of the brothers and I can't think of his name, it could be Alfie, I'm not too sure.
Arthur,
thanks Lynn. Arthur experiences PTSD at these just strange times. He can be sat in the pub having a pint and he starts hearing bombs and people shooting, and it takes him back into, it was the First World War, I believe, so I guess he may have been at Flanders or somewhere like that. So it takes him back to that, and he starts responding and reacting to that. He gets very aggressive and very violent. And that is a classic example of how PTSD can impact on somebody at any moment in time. It can be a trigger, whatever the trigger is. And I think sometimes with Arthur, it's just a sound, a bang, a broken glass, or something like that. So the amygdala responds to that. Now, sometimes the amygdala works in conjunction with our hippocampus. Now, our hippocampus is something that we focus on a great deal with people with a cognitive issue, because it's responsible for memory. It's got other jobs, other roles, but one of its key roles relates to memory and deals with memory. So you can see how the two will link, the amygdala and the hippocampus, when it comes to past experiences. So what I want us to think about is, how do we manage that? How do we support somebody through that challenge? Because very often people living with a neurocognitive or a neurological disorder may start to experience, and very often do, when I say may, I'm going to change that, to very often do express behaviours linked to either developmental trauma, which is all about the trauma experienced as a child that was never resolved, or PTSD from adult life. And how do you manage it? How do you deal with it? How do you work with that? There's a bunch of different therapies, and a fantastic therapy that was discovered to work really, really well with trauma, psychological trauma, is something called EMDR, which is eye movement desensitization and reprogramming. And it sounds really simple, but there's a technique to it, and there's an 8-stage process, but it's very, very effective. So that's one of the tools that we use, one of the tools that I, as a clinical dementia specialist, practicing neuropsychotherapy, that's one of the tools that I use. The second tool can be cognitive behaviour therapy. That's very useful as well. And cognitive behaviour therapy helps people rewire their thought processes. So imagine you're rewiring your home. All your wiring is done, it's broken, it's not good anymore, it has to be replaced, so you rewire the whole thing, and that is a similar process. That's what cognitive behaviour therapy does. Rewires your thought processes, take you from a negative to a positive, puts you in control. And this is the key word here for any kind of work in trauma, is about empowerment. And it's about really controlling your belief system. So the ABC of CBT, activating event, belief, consequence. The activating event is something we can't do anything about. It's happened. It's happened. Okay, it's in the past. Happened. Can't change it. What we can do from that is learn from it. And as we learn from it, it taps into our belief system. And it's our belief system that we can change. And we can change that as part of the CBT process. And then we have the C, the consequence. We can have a positive one, or we can have a negative one. Of course, we're looking for a positive one. So using those two things is really, really useful. The third modality that I use is hypnotherapy and hypnopsychotherapy. Very, very powerful tools to use for managing lots of different situations and circumstances. And clinical hypnosis is a very, very powerful tool, and it's one of the things that I've trained a number of people around the world to use, so they also incorporate it into their work as therapists. So they may use EMDR, they may use hypnotherapy, hypnopsychotherapy, they may use CBT, and they may use a whole bunch of other modalities, because there are other things as well that people use. But these are the three things that I use, and these are the three things I find comfortable with and successful outcomes with as well. So that's a little bit about trauma. And if you're experiencing it, if you get to a point where your trauma becomes unmanageable, please seek help. Go and see your neurologist, go and see your therapist, contact your clinical dementia specialist, reach out to somebody and get support with it, because it's something that can be treated. It's something that can be effectively managed and very often can be resolved completely. I have Lynn here with me. Good morning, good afternoon, good evening, Lynn.
Hello.
There we go again with her. Hello. Yes, Lynn, you've got some questions, I believe.
Well, I was going to say, how come past trauma, turns up often with people living with dementia? Is it common for everyone to have some type of trauma? But why in particular, I've noticed in your practice that it's almost a common thread with the majority of your patients. Right. Is that a human experience, or is that something in particular that's unique to people living with a neurocognitive disorder?
Okay, so the first part of that question is, why does that impact on people living with Alzheimer's disease or another form of neurocognitive disorder? This is because certain parts of the brain are damaged because of the biological processes of the disease. So whether it's Alzheimer's disease, Lewy body dementia, Parkinson's, vascular dementia, mixed dementia, whatever it might be, certain parts of the brain are being damaged. And if there's damage to the amygdala and damage to the hippocampus, which is very common, especially the hippocampus, then this is why people the trauma starts to surface. And it's
been suppressed.
It's 99% of unresolved, unaddressed trauma that has been suppressed over the years.
Okay.
Absolutely.
So it's been suppressed, and now that there's something, let me just say, broken with the wiring of the brain,
right?
Something not working correctly, it allows it to surface.
Right. And it's in particular, if we're working with somebody with frontal temporal lobe dementia, where the inhibitions are compromised. Once your inhibitions are compromised, there is nothing to hold you back. There is nothing to stop you from expressing and experiencing certain things. So, people might start swearing or shouting or screaming or being abusive when they have never been that before. Relatives are shocked and they say, "Oh, my mother would never use that kind of language." Well, this is because parts of the brain that are responsible for inhibition is broken. So there are no inhibitions anymore. So all these things start seeping through. And then, most of our stuff is buried at a subconscious level. When we talk about the conscious and the subconscious level, consciously 5% of all our experiences, all our behaviors, all our thoughts, all our dreams, everything in our world, our life, is about 5% conscious, 95% subconscious. It's all buried underneath the surface. So when layers are removed, then these things can start to surface and people start to experience them. And this, we're thinking about, particularly if you think about people in the 70s and 80s now, developmental trauma was very, very common as a kid. So when they were children, developmental trauma, which wasn't recognised and people didn't notice it, didn't do anything about it, was very common at that time. Children being sexually abused, and they would tell the parent, and the parent would say, "Well, stay away from there now, we won't deal with that anymore, we won't go to that relative," or whatever it is, and then it's just pushed away. It's never dealt with. So developmental trauma in particular, with sexual abuse, physical abuse and verbal psychological abuse of children back in that time is now surfacing when they're in their late 70s, early 80s. So we're kind of addressing those issues now. And that's a good thing, because once we're addressing that developmental trauma or PTSD, whichever trauma we're addressing, it empowers the individual. It finds a resolution. They find some peace. They find some inner peace. And that means that managing the symptoms of their cognitive disorder, which, as we know, is driven by fear and anxiety, becomes much easier. So the fear and the anxiety can be suppressed. It can be put back where it needs to be, which is in our feet. We need it. We have anxiety. We have anger. We have to have it. It's part of living. We'd die if we didn't have it. So, but it's down in our feet. So if we want it, we can go and get it.
So we don't want to ignore it when we identify something going on with our loved one or in ourselves.
Exactly.
We need to say something, and we need to get the right kind of guidance, because it can be addressed. You can live through it, work through it, and you can have a better quality of life. It doesn't have to be something that brings everyone down.
Right, exactly.
That stops you from being as happy as you can be.
Right, and in my practice, we use the Nightingale triangle, the trauma, for distinguishing trauma. We have a specific triangle of therapy that we use for that. You go to the website, drdanielnightingale.com, you can find out more about that. You go to Psychology Today and look at my profile, you can find out more about that as well. But absolutely, as Lynn says, once these things start to surface, get help. Go get help. Seek help. Speak to your neurologist, speak to your therapist, speak to your primary, speak to somebody, reach out to somebody and get the correct support. Any questions you have for me, you can contact me on this YouTube channel. You can follow me on Instagram, Facebook, and you can contact me through any of those platforms. And that's it for today. So thank you for joining me. That has been useful. I know it has, and I know you're going to find some benefit in it. So just before I go, guys, I want you to remember and say with me, dump the soda. Have a great week.